Serena Williams made headlines this week for not her achievements on the tennis court, but her openness about the challenges she was facing since giving birth to her two children. Williams revealed she lost about 30 pounds after her second child by using a GLP-1 medication such as Wegovy or Zepbound through the telehealth company Ro. Now, she serves as a paid spokesperson, and she's open about that. Her husband, Alexis Ohanian, is an investor and serves on the company's board. That's raising some questions about safety, access, and potential conflicts of interest. CBS News medical contributor Dr. Céline Gounder joins us now. She is also the editor-at-large for public health at KFF News. So I want to start with, as someone that is a new mom, you might be struggling with different things and you're wondering, is this safe to take while I'm pregnant? Is it safe to take while I'm breastfeeding? So can we start there?
Yeah, currently the recommendation would be that you want to let the medication wash out of your system before you get pregnant. For about 2 months, you want a washout period. Now, that said, the data on the safety during pregnancy is mixed. We've seen an increased risk of fetal growth issues and birth defects in animals when they're on these medications during pregnancy. On the other hand, there was a large study looking at women who accidentally were on these medications before they knew they were pregnant, and there was not an increased risk of birth defects in that group. That was some 50,000 women in that study. So right now, we just don't have a clear answer. And as for breastfeeding, the good news is we have one tiny study that did not show semaglutide, which is the medicine in Ozempic, Wegovy. We didn't see it in breast milk. So it seems to be safe, but again, the jury's still out on that.
So what about this idea? It's been, 6 months to a year. You still are maybe carrying that weight. You feel like you're doing all the right things, and maybe you're still breastfeeding. Is it safe to take then, after you've had the child and you've waited a little bit?
I mean, look, these medications work really well. In clinical trials, people have lost 15 to over 20% of their body weight on these medications, but none of these trials focused on postpartum women. And that gap in research is really important. We know that women who are pregnant or the postpartum period after pregnancy are really under-researched. And unfortunately, that kind of research, women's health research, particularly on women of color, which is the highest risk group for obesity and postpartum issues, under this current administration would be considered DEI. So we can't really be conducting that kind of research right now.
So you don't have the research, therefore you don't have the knowledge or the education. I want to turn to this issue of trust. She is Serena Williams. People know her from her tennis and many other things that she's involved in. But her sharing the story, knowing that she's a spokesperson and then her husband's an investor, do you think that could be a conflict of interest for some people? Or is it more like, no, if she's doing it, then it must be real and she's healthy and she's an athlete, she would know?
Well, it can be both, right? But if you have Serena Williams, who is talking about her journey, on the one hand, is very brave. There's a lot of stigma still around obesity. And because she's a celebrity, she can help destigmatize and people will listen. But on the other hand, over 40% of births in the United States are covered by Medicaid. Medicaid does not cover these medications. So right off the bat, that about 40% of women who go through pregnancy will not be able to afford these medications, and likely even more than that.
I didn't realize it was that high. Wow,
yeah.
40%.
Yeah, so while this can be helpful to those who can afford it, who can access it, there's a huge gap in need.
And it's still somewhat new.
Still somewhat new, so we don't have all the answers yet. Yeah.
Well, you have all the answers compared to most people. That's why we have you here. Dr. Céline Gounder, thank you so much.